Hey everybody, this is Dr. Paul Thomas with Plum Health DPC, and I'm joined by my esteemed colleague, Dr. Jamie Qualls.
Hello,
Hey Dr. Jamie, how are you doing? Are
I'm
you
good. How are you, Dr. Paul?
good? Surviving the pandemic
Trying
and
to.
doing our best for our patients every day, of course.
Yep.
And so today we wanted to chat a bit about what's going on with the coronavirus and how it's affecting people here in Southeast Michigan. And so we're going to run through some information, and hopefully this will help everybody stay up to date. Currently, we're seeing about, 14. We're at 550,000 confirmed cases, and we're currently at 14,000 deaths. And that's really a tragic number. That's an incredible amount of people who have been affected by the coronavirus in our communities. And the good news, though, is that it seems to be that the number of cases has been declining over time. We saw this huge spike in cases around Thanksgiving, November, and around Christmas time in December. But fortunately, I think with the new vaccine that's come out and more people getting vaccinated, we're seeing fewer and fewer new cases. And we also saw a lot of deaths early on in the pandemic and a lot of deaths later in the pandemic, like in November, December. And I think this initial spike was due to perhaps a more virulent strain initially, and perhaps hospitals being unequipped to handle the mass amount of people coming through with new infections. And then these higher cases perhaps were from family gatherings and people giving it to older adults and their families. So that's one thing I really wanted to focus on. Jamie, maybe you can talk about these different age groups who are affected.
Sure. I think, as these statistics show, it really seems to be hitting certain age groups more harder than others, specifically in the, 20 to 29-year-old age range. We are seeing that these groups of people tend to kind of be out more, be congregating among others. So we're definitely seeing spikes in those age groups. Also seeing a little bit of a spike in the 50 to 70-year-old age range as well. So those are two of the groups that we're trying to focus on. Yeah.
And so those are the cases. And then just looking at the deaths, even though young people get it and they may be asymptomatic, they could definitely transfer it to an older adult in their family, and this could have really deadly consequences for that older adult. And so just to kind of like really put a fine point on that, this 80-year-old group and up, there are only 27,000 cases, but that turned into 6,600 deaths among that age group. So that's why it's so important to wear the mask, maintain the social distance. And even though you may be asymptomatic when you're 20 or 30, you could pass it on to somebody who's an older adult, and that could be really harmful, end up with a hospitalization or even death. And so, based on that data and the vulnerability of older adults, that's why we're rolling out the coronavirus vaccine in the way that we've been rolling it out as a state, and really trying to get that coronavirus vaccine to healthcare workers and long-term care residents and staff, like you think of nursing homes and group homes, congregate settings. And then we're now into this phase 1B where we're really trying to get it to those 75 years of age and older. And over the past couple of days, anyone over the age of 65 can get the vaccine at this point. So, here in Wayne County and Detroit, we've seen drive-through at the TCF Center, or what used to be known as Cobo Hall, where anybody who's over the age of 75 can drive up and get the vaccine. And if you're 65 years and older and driving somebody who's 70 plus, you can get the vaccine as well. So that's been a nice thing to see in our community. And then nationally, I think, as far as vaccine distribution goes, it's been going okay. We've seen 19 million people get the vaccine, and about 3 million get both doses. So that's currently like 1% of the entire population in the US has gotten both doses. So still a long way to go. But I'm optimistic that with the new drive-through venues that we've seen, I recently heard that U of M is opening up a new vaccine site at the Big House, and other large-scale vaccine efforts like that could really put a ding in the number of new vaccines. So that I'm hopeful about that. So Dr. Jamie, you've had both vaccine doses. Did you experience any side effects when you got the vaccine?
A little bit. I think I was the first vaccine. I didn't have any. Maybe just a little bit of arm tenderness at the injection site. It didn't last very long. The second one, we are hearing that it's more common for people to have some more side effects after receiving the second one. Specifically, you might feel fatigue. You might have more pain or swelling at the site of the injection. Some people are also experiencing chills and fevers, as well as headaches. I know quite a few people that have gotten maybe within 6 to 8 hours after getting the second vaccine, they start to get the pain and the swelling in their arm, as well as feeling feverish, might have some chills, but it doesn't last long. It might last a half a day to a day. And that's not necessarily something that you have to be worried or concerned about. That's just your body ramping up its immune response to the virus. So that's actually a good thing because it shows that your immune system is doing the job.
Yeah, similarly, I also had both doses of the vaccine, and the first dose that I had, I definitely felt some arm soreness and some fatigue and a little bit of headache. I usually don't like take a nap on a Saturday, but I got my vaccine dose on a Friday, and that Saturday I definitely felt like, oh man, I'm feeling quite a bit tired. I took in like hour and a half, 2 hour nap, which is pretty unusual for me. But after that, I was feeling great, kind of back to normal about, I would say 24 hours after getting the vaccine. I felt back to my normal self. And then similarly with the second dose, I had similar feelings. Like I felt definitely some arm soreness and then quite a bit of fatigue. Again, I got vaccinated on like Friday evening, so I felt those symptoms on Saturday.
Yeah.
And I think that's been pretty typical. I haven't heard of too many people getting a fever or really feeling so sick that they have to go to the hospital. It's mostly people are taking Tylenol or ibuprofen after getting the shot, and that's helping with whatever residual side effects.
Yeah.
Let's see if I can share my screen again. Screen share. Yeah, and so the CDC put out this flyer. They talk about the things we talked about: tiredness, pain at the injection site, sometimes fever, chills, and headache. Those are usually the most common. If you were to have a anaphylactic reaction, usually those happen within the first 5 minutes, sometimes up to 15 minutes. So that's why a lot of vaccine sites will have people wait on site for 15 minutes before driving away. Or if you get it in person where you're walking up, they have you wait in like a holding area after you get the vaccine. For the drive-through sites, they say you'll honk your horn if you start experiencing like an anaphylactic reaction. Then somebody would theoretically come up and give you a shot of epinephrine and then get you to the nearest emergency department for further treatment. So in addition to all of that, we're starting to see these variants of the coronavirus that are coming through. This is from the Detroit Free Press today, talking about the different variants. And the one that they talked about was the B117 out of the UK. And they were saying that it was 1.5 times more transmissible and spreads about 50% faster. But don't panic, because this variant does not yet appear to cause more severe disease. Our current tests can identify it, and our current vaccines appear to work against it. So this is all good information you should know. Know that this variant probably exists. It probably has existed in our community for a while now. It's just that we probably don't have enough equipment to differentiate the different vaccines. And that's why I think we're seeing more reporting of it at U of M coming out of Washington County, because they're probably testing for multiple variants there. Whereas like community doctors and urgent cares probably are only testing for coronavirus, not its variants. So that's it, unless you wanted to add anything else, Dr. Qualls.
I think that was kind of big highlights of, what's going on currently. I think it's important for everybody to still maintain safe social distancing measures, including wearing your mask, especially covering your nose and mouth when you're around other people or you're out in public. The restaurants and bars are supposed to be opening again on February 1st, most likely. So as we start to kind of congregate again in public, it's going to be really important to keep those things in mind. Make sure that we're keeping our hands clean, using hand sanitizer. Don't go out if you're not feeling well, all of those kinds of things.
Yeah, exactly. I think that's perfectly well said. And just remember, we're still in the middle of a pandemic. Even though we're getting more vaccines out to the community, we're still going to see people affected by the virus, infected by the virus, and things could change. If there's another outbreak, we could see things reverse. And, that's the last thing we want to see as a community. We want to see people out and about, engaging in the community, businesses reopening, and all of that. So let's each do our best to wear our masks and keep our distance and wash our hands, and hopefully we can be a part of the solution here. And then Dr. Qualls, I got to give you a shout out. Dr. Jamie Qualls is one of our family physicians that works with us with Plum Health. She happens to work out of our Farmington Hills office, and she's a tremendous physician. We're really lucky to work with her. Her patients have been giving her some great reviews. She's currently has 16 five-star reviews, which is tremendous. Because I know that she goes above and beyond for her patients. And so thank you, Dr. Qualls, for taking the time to talk with me today, and stay safe out there.
Thanks, Dr. Paul. I appreciate it.
All right. Have a great week. See ya.